Emergency medicine is a vital field of healthcare that plays a critical role in managing patients in various states of medical crisis, including those experiencing shock. Shock is a life-threatening condition where the body's vital organs are not receiving an adequate supply of oxygen and nutrients due to a significant drop in blood pressure. It can be caused by various underlying conditions, and prompt recognition and intervention are essential for the patient's survival. Definition of shock. Shock is a medical emergency characterized by a systemic lack of perfusion and oxygenation to tissues, resulting in organ dysfunction and potentially irreversible damage. Types of shock. There are several types of shock, including hypovolemic shock, due to severe blood loss, distributive shock, resulting from blood vessel dilation, as seen in septic or anaphylactic shock, cardiogenic shock, related to heart dysfunction, and obstructive shock, caused by physical obstructions to blood flow, like pulmonary embolism. Signs and symptoms. Common signs of shock include rapid heart rate, low blood pressure, cold and clammy skin, altered mental status, and decreased urine output. Causes of shock. Shock can result from a variety of causes, including trauma, bleeding, severe infections, heart problems, allergic reactions, and more. Hypovolemic shock. Hypovolemic shock occurs when there is insufficient blood volume in the circulatory system. This can be due to trauma, internal bleeding, or dehydration. Distributive shock. Distributive shock, as in septic shock, involves a widespread inflammatory response leading to vasodilation and a drop in blood pressure. Cardiogenic shock. Cardiogenic shock is often due to heart conditions such as a heart attack, where the heart is unable to pump blood effectively. Obstructive shock. Obstructive shock is caused by physical obstructions to blood flow, such as a pulmonary embolism or cardiac tamponade. Treatment. The management of shock involves addressing its underlying cause while stabilizing the patient. This may include fluid resuscitation, blood transfusions, medications to support blood pressure, and surgical interventions. Importance of early intervention. Early recognition and intervention are crucial to improving outcomes in shock patients. Delayed treatment can lead to organ failure and death. Fluid resuscitation. Administering intravenous fluids, such as saline or lactated Ringer solution, is a primary intervention to restore blood volume in hypovolemic shock. Blood transfusions. In cases of severe bleeding, blood transfusions may be necessary to replace lost blood components. Medications. Medications like vasopressors and inotropes may be used to support blood pressure and cardiac function. Septic shock management. Managing septic shock involves treating the underlying infection with antibiotics and providing support for organ dysfunction. Surgical interventions. Surgical procedures may be required to address physical obstructions or correct cardiac issues contributing to shock. Monitoring. Close monitoring of vital signs, oxygen levels, and laboratory values is essential throughout shock treatment to guide interventions and gauge the patient's response. Complications. Shock can lead to complications such as multi-organ failure, disseminated intravascular coagulation, DIC, and long-term organ damage. Prognosis. The prognosis for patients in shock depends on the type, cause, and timeliness of intervention. Early recognition and treatment greatly improve survival rates. Prevention. Preventing shock involves managing underlying conditions, e.g., controlling infections, managing chronic diseases, and taking safety measures to reduce the risk of traumatic injuries. Continued care. After stabilizing a patient in shock, ongoing medical care and monitoring are essential to address any lingering issues and prevent recurrence. Emergency medicine professionals play a pivotal role in diagnosing and treating the various types of shock, with the goal of stabilizing patients and addressing the underlying causes to improve their chances of recovery and survival.